took a pregnancy test and it is positive. Congratulations. But have you ever wondered what you should do as soon as you get a positive pregnancy test? Stay tuned to know 10 important things that you will have to do as soon as you become pregnant. Hi, I am Saranya, the founder of Babypedia and a birth professional. I have more than 5 years of experience in helping more than 2,000 families navigate pregnancy, birth, and postpartum with a lot of confidence. So now, what is the first thing that you will have to do as soon as you get the positive pregnancy test? I know it can be a lot to observe, though you could be somebody who was planning to become pregnant, you were eagerly waiting for the positive pregnancy test, or you could be somebody who this positive pregnancy test has come as a shock. Whatever stage you are in, take some time to first observe all the feelings that you are experiencing right now. It is okay to take a few days to come to terms with being pregnant. No reaction is the right reaction, right? So anything that you feel could be okay. So take a few days and start experiencing and absorbing the fact that you are pregnant. The second thing that you will have to do is talk to a doctor. So you could be talking to an OBGYN, that is an obstetrician or a gynecologist or a mixture of both. These are the doctors who are specialized in helping and taking care of pregnant women. So you will have to ask them when to come for the first appointment. There are some who would ask you to come at 6 weeks, that is 2 weeks after you get the positive pregnancy test, or 6 weeks after you've missed your last menstrual cycle. Some would ask you to come at 8 weeks. So when you go, in case you have become pregnant through a fertility treatment, then you would be asked to go immediately. So when you go to meet your doctor may, do a repeat test to confirm that you are pregnant. They may also do a transvaginal scan if you're going anywhere after 8th week to check if your baby's heart has started beating and your baby's growth is correct according to the gestational age from your last menstrual cycle. Your doctor may also be giving you supplements like folic acid, iron, calcium, etc. if you are not already on it. And your doctor would also recommend a blood test to check for any deficiencies or any infections that you may have. In case you are taking any earlier medications for health issues that you have, please discuss this with your doctor at this appointment itself. The third thing that you will have to do is something that most of us know, but start eating healthy if you have not already started doing it. Try to include a lot of easy to digest food and do not eat for two in quantity. Start eating more nutritious food. Eat for two in the quality of food that you are taking, but not in the quantity of food that you are taking. Eat only when you are hungry and eat till your stomach is 3/4 full. That is more than enough to nourish your body and to also help your baby grow in a healthy manner. Eat 1 serving of fruits and 3 servings of vegetables every day, and definitely increase your protein intake and your fiber intake, because at this stage of pregnancy, a lot of women will suffer from constipation. So you will have to increase the fiber intake. Try to avoid any alcohol, nicotine, or illegal drugs, and definitely do not eat any raw food, unpasteurized milk, or any and limit your caffeine intake to less than 200 mg. The fourth thing that you will have to do is drink lots of water. So how do you calculate the amount of water you will have to drink? For every 20 kgs of your body weight, you will have to take 1 liter plus 1 liter extra for pregnancy. So if you are pregnant and you weigh 60 kgs, then you will have to take 4 liters of water. Do not gulp down the water, but keep sipping it throughout the day. Try to complete your water intake before 6 p.m. and just have only 2 to 3 tumblers after 6 p.m. This is to ensure that you're able to sleep better and to reduce the number of trips that you take to the restroom to urinate. Okay, so next, listen to your body. That is something that's very important during pregnancy, and the signs that your body is giving you will vary for each person. It could be different for each of your pregnancies. So it's okay to take rest if you're feeling tired, and it is okay to be active if you feel like you have the energy to be active. Do whatever suits you. So some of the signs of early pregnancy could be sore breasts, sensitive nipples, nausea, vomiting, tiredness, extreme sleepiness, food aversions, frequent urination, mild cramping, and headaches. In case you do not experience any of these symptoms, that is also normal. So do not panic and do not think that there is something wrong with your pregnancy. There are some women who do not experience any symptoms, but yet they will be pregnant. So don't worry too much about it. The sixth most important thing is get informed. You can join an early pregnancy class or a community. We at the Babypedia tribe will definitely welcome you. Please do join us and get informed. You could also read a lot of books. I will be giving the referral for the books in the description box below. Be prepared for mood swings. That's the seventh thing. Mood swings is very common during pregnancy and it is caused by all the fluctuating hormones. The same hormones that are ensuring that your baby is growing well is also causing you mood swings. So you can call mood swings as a side effect of pregnancy. And it is very normal. So please do not feel guilty about experiencing mood swings or feeling irritable, angry, or you feel like crying often. This is perfectly normal. What you will have to concentrate on is accepting these emotions and letting go after a certain period of time. Do not let these emotions extend on towards, a longer period like a couple of days or even more. And it should not be affecting your day-to-day activities. If you feel like it is affecting your day-to-day activities and you are experiencing these so-called negative emotions for a long period of time, then please meet up with your doctor or another mental health professional who will help you manage these emotions and navigate pregnancy with much more ease. The eighth important thing is exercise regularly. Walking, yoga, swimming, strength training if you have already been lifting weights before you became pregnant, dance are all good options for exercises during pregnancy. You will just have to take two precautions. One, get the go-ahead from your doctor before you start any type of exercise. Two, go to an expert who is trained in teaching pregnant mothers because there's a whole lot of variations and precautions that you will have to take when you are doing exercises during pregnancy. So going to somebody who is trained in teaching pregnant mothers would be the best choice to ensure that there is no risk involved. Always remember to stay hydrated when you are exercising and eat a small meal 20 minutes before you start. This will give you enough energy to manage through the exercise session. Also avoid exercising in a hot room. Maintain the room temperature by opening the windows, or you could also exercise in a mildly air-conditioned room. The ninth important point is if you have cats in your house or your neighbors are growing cats, avoid cleaning the cat's litter box. Take care. You can take care of your pet. You can pet your cat, but wash your hands very well afterwards. Cat litter is filled with a lot of bacteria and parasites. One in particular that is called Toxoplasma gondii is particularly dangerous to expecting mothers. It can cause a lot of complications in the pregnancy and for your baby. So remember, do not clean cat's litter box if you have cats as pets in your house. The 10th point would be start researching your options for a doctor and choose somebody who suits your idea and your ideologies of birth. So, you could be somebody who is looking for a VBAC, that's a vaginal birth after cesarean, or you are somebody who wants to have a vaginal birth. Then you would have to choose a care provider or a doctor who specializes in that and who has a lot of experience in facilitating or helping mothers have a VBAC. Okay, so choose somebody who aligns with you, who you feel comfortable with. Remember that pregnancy and birth and postpartum can be a very intimate process for a lot of us. So you will have to go to a doctor who you feel comfortable with. Only then you will have a birth experience and a pregnancy where you feel comfortable and you come out of this beautiful period feeling very empowered and confident. Remember that what you feel during this period not only affects you lifelong, but it can also alter your baby's thoughts and how they feel towards birth in their life as well. So that is why we say that pregnancy and birth is not important just for you, but it can alter the course of your baby's life and their thoughts towards their own body and their own birth, and also the birth of their children in the future as well. Right? So finally, please remember that self-care is never selfish, especially at a sensitive and precious period like pregnancy. So take time for yourself. It is okay to cook less or not to clean your house. Just listen to your body. If you feel like taking rest, doing nothing for a day, please go ahead if you can do it. Take a break from work if it feels very overwhelming. It's okay to call up and chat with a couple of friends. Have a community that will always be there for you during this time of pregnancy, birth, and postpartum. Plan your week ahead so that you do not feel very overwhelmed, and always have a little bit of time to rest, to catch up on your breath during pregnancy. So all the very best and have a healthy, happy pregnancy and birth experience. This is Saranya signing off.